This segment of CoastLife is sponsored by Beebe Healthcare.
How many times have you maybe gone to see your doctor, gone to the hospital in urgent care, and you see the person taking care of you, and it's like their name and some random letters? And you're like, I don't know.
Almost every time.
What that means.
What do they mean?
Yeah, I don't know. You're like, I know you're smart, and that's all I know. But we want to learn a little bit more today about what's called APCs. And I don't know how to explain it, so who's going to explain it? Well, the experts, of course. We have Amanda Connoyer with Beebe. Thank you so much for being here today.
Absolutely. Thank you for having me.
Yeah, happy to have you. So first, if you could explain what an APC is, and then we'll get into what Beebe is doing with the community.
Absolutely. So APC stands for Advanced Practice Clinician. That's going to be the group that is nurse practitioners, physician assistants, certified nurse midwives, as well as CRNAs, which are the people that actually put you to sleep when you have surgery. And then we have CNSs, which are clinical nurse specialists, and they work alongside of our physicians to provide care for our patients.
I love this. And you described something really well earlier when we were chatting.
Yes.
You know, like sometimes you go to the hospital, let's say, and then you find out, you're like, wait, you're not a doctor? It's like, well, hold on, doesn't, you know, let's learn a little bit more about that. So what do those different titles and letters mean when it comes to getting care?
That's correct. So we are not doctors, we are not physicians, but we do go through a lot of schooling. So to be an advanced practice clinician, you have to have a minimum of a master's degree. You know, there are some people that are grandfathered in under different programs, but currently they are master's prepared people. Many people even have doctorate degrees. So like myself, I got my bachelor's degree in nursing, then I got my master's degree as a nurse practitioner, and then I went on to get my doctorate as a nurse practitioner. So I went through quite a bit of schooling. If you ask my husband, he'll laugh about it. So, you know, I went through a lot of schooling to become an expert in my field in family practice. And then, you know, people that work in those specialties like cardiology per se, they even go into additional training or take additional courses or tests to become specialists in what they love to do. And so once they find that niche, they do additional trainings to be able to be like, yes, I know what I want to do. This is my passion, and I want to be able to provide the best evidence-based practice for the people in that community.
Absolutely. And I mean, people are receiving quality care.
Absolutely.
No matter whose hands they're in.
Absolutely. When the person is getting you ready for your surgery, you know, you're seeing that person in the outpatient setting, or that person is seeing you in the hospital, rounding on you before your surgery or after your surgery, that's probably an advanced practice clinician, because that then allows your physician to concentrate on performing that surgery on you and providing the best care there.
I think this misconception a lot of times, and you tell me if you agree, comes from a lot of these like medical shows too.
Yes.
Because, you know, I was just watching one the other day. It's like, oh, I'm going to check you in, and I'm going to check your heart rate, and I'm going to do your surgery. And I'm like, wait, a surgeon wouldn't do all of that.
That's true. That's true. Yeah. And, you know, there are times where a physician or an APC are rechecking your blood pressure.
Yeah.
You know, you go in to see your family practice provider, and you sit down, and your blood pressure's a little high. And they're like, you know what, we're going to do your visit. At the end, we're going to recheck it and see what's going on. So maybe they do, but they're not going out and calling you in and doing your blood pressure and signing you in and doing all those things. They have the staff that are wonderful, that do all of that for them, that they trust, that are getting the right things that they need. And then they're doing the piece that's theirs, and then they have the people that follow up. You know, I'm not going in and operating on you, but I may see you before to get you ready for the doctor to go do that surgery for you.
That makes sense. Well, it takes all sorts of people. And you guys too are increasing education at Beebe, so can you tell us a little bit more about that?
Yeah, so currently we are working on kind of having standardized onboardings in different places for our APCs to make sure that it's kind of a seamless process for our advanced practitioners, that as they're transitioning into new specialties and becoming experts in a new field, that they have the resources and support to be those experts and to know what the evidence says and to be successful in those roles, whether that's a brand new graduate or somebody that was experienced in something else or learning a new role. And so one of the things that we are doing is you know, kind of looking at other resources outside of what we have here in Delaware and looking at programs that are available. And so we are looking at partnering with even our foundation to see what resources are available to us to provide education to our APCs to make sure that they have the most up-to-date education as they transition into these roles. And so that really wouldn't be possible without our community support. And so we do really appreciate all of that.
Yeah, of course. And of course, maybe if you were looking to giving to the
Sure.
Beebe Foundation.
Absolutely.
It's a great time of year for it.
It is, absolutely.
I don't think you really understand or maybe appreciate how much your local hospital does until you're in there. So,
Absolutely.
yeah, it could be a good thing to donate to. Well, Amanda, thank you for telling us all about this. We really appreciate it.
Absolutely. Thank you guys for your time today.
Of course. All right, you guys, coming up on CoastLife, though, we have a little bit more to get to, so stick with us. We'll be right back.